host Mike Bellamy on WICC.
All right, it's time to talk to Dr. James Pinke. He's with the Pinke Eye Center, and we always talk to him a couple of times a year here. Always interesting stuff. Dr. Pinke, how you doing today?
Great. How are you today?
All right, always a pleasure to see you. Let's get rolling on this. Lipoflow for dry eye syndrome. First, before you tell us what that's all about, what are some of the signs that someone might have dry eye?
There are many signs. Itchy eyes, which people typically, relate to allergies, can be part of dry eyes, can be allergies. Sandy sensation in the eyes, variable vision during the day, blurred vision intermittently during the day is often a sign of dryness. When our eyes are dry, we don't coat the eyes as well in terms of the surface of the eye, and that creates intermittent blurred vision. Sometimes people find that if in between blinks, their vision gets a little blurry, and then they blink, which coats the eyes with the oil and the water that coat the surface of the eye, and then they see better for a few seconds, and then it gets worse again.
Okay, and this is a chronic thing for some people.
Oh, it's a very chronic thing, and it's a lifelong type of a problem for people as they get older.
Okay, now Lipoflow, tell us about that. What happens there? This is... You call this a procedure, right?
It's a procedure.
Okay.
It's not an operation.
Okay.
We're not operating on anybody.
Okay. All right.
For this problem anyway. And what we're doing is we are stimulating the oil glands, which are called meibomian glands, that line our eyelids, the upper and lower lids. We have about 100 of these glands between all four eyelids. And we find as people get older that they lose a bunch of these glands, and the remaining glands tend to get plugged up. So this is a 12-minute treatment in the office where we put these tiny little cups on the eyelids, and these cups warm up the lids so that it melts the oil that's in our eyelids. And once the oil is melted, this device gently pulsates and opens up the pores of the eyelids to allow the oil that's in the glands to come out more effectively.
Is this a one-time procedure, or is this something that you have to do every year, every couple of years?
We're recommending it every year or two, depending on the symptoms of the patient and how healthy or unhealthy their eyelids are. We know that about 85% of people with dry eye symptoms really have largely meibomian gland or oil gland dysfunction in their eyelids. And what this is doing, this treatment, is we're trying to improve the remaining glands so that they get a good surface coating of oils, natural human oil, on the surface of their eyes to coat the cornea and allow them to see more clearly.
Okay, and what's the recovery time once you're done?
Oh, there is no recovery. It's
okay.
immediate. People, we often do this when a person comes in for their regular eye examination. If they have dry eye symptoms, we can do the treatment that day, and then they just go home. They're fine.
Okay, so when it's done, you get in the car, you can drive, you can do anything, live your life.
Absolutely.
Right.
There's not a surgery. It's just a procedure. In fact, what we did to make things even more comfortable for people, because the procedure is very comfortable, we actually bought one of these big massage chairs. So we give the person a total body massage at the same time that they're having the treatment done, and they feel really good when they're done.
Oh, nice. Very nice. I got to stop by the office just for the massage. I like it. All right.
I think of it in some ways like when a person goes to the dentist and we recommend, or the dentist recommends, that they have their teeth cleaned. We don't prevent cavities that are already there. When we clean people's teeth, I don't think.
Yeah. Right.
I'm not a dentist, so I don't know for sure. And we also we think that cleaning probably helps in terms of gum disease. Here, we're not cleaning your teeth, but we're cleaning the eyelid glands to try to, through good hygiene, help to protect the surface of the eyes and maintain healthy eyes.
All right, we're talking with Dr. Pinke, Pinke Eye Center in Shelton. We'll give you an address, a website, all of that good stuff. That's all coming up. Let's talk a little bit about laser-assisted cataract surgery.
Sure. I brought laser-assisted cataract surgery to the area about 3 years ago. And what this does is it eliminates, for most patients, the blade that people get nervous about in surgery. The laser makes the incisions into the eye, and it opens up the cataract with a very focused beam of light and softens the cataract so that we can do the rest of the procedure as efficiently and precisely as possible. I think this is a great addition to cataract surgery, which is already a wonderful procedure, and this just makes it that much better in my hands.
How bad do the cataracts have to be in order to have this surgery?
Cataracts really don't have to be bad at all. In fact, I have patients who don't even have cataracts yet, who just for refractive reasons, whether they're very nearsighted or very farsighted or have a lot of astigmatism, want to have their natural clear lens exchanged for an implant to give them normal distance and near vision, or near normal distance and near vision. In terms of reimbursement, if it's done for refractive reasons, the insurance companies are not interested in reimbursing for it. But if it's done for cataract reasons, then insurance companies do what they've always done, which is to pay for the basic procedure.
All right, this may seem like a stupid question, but will it prevent cataracts if you have it before you get a cataract?
Oh, of course, yeah, because what we're removing is the natural human lens. That's what becomes a cataract, the human lens inside of our eye. So in a cataract situation, the lens has gotten yellowed or cloudy, and we go in and remove the yellow, cloudy lens. In a non-cataract situation, we're removing the clear lens before it even becomes a cataract. Once it's gone, it's gone.
Interesting. Can you hang on for a moment?
Absolutely.
All right, don't go anywhere. Stick with us. We're going to go to Kelly Quinton right now. She takes a look at 9:40. We're talking with Dr. James Pinke from the Pinke Eye Center, and we're talking a little bit about cataract surgery. Now, cataracts happen to all of us eventually, right?
Almost all of us. There are a few people who don't get cataracts, but almost all of us eventually will get them.
Okay, so as long as we're still living, there's a good chance that you're going to get cataracts. Now, when you do have cataract surgery, how long is the procedure? How long is the recovery time?
It varies from surgeon to surgeon. My typical cataract operation takes me in the range of 6 to 8 minutes to do. There's there are a few points on that. There's no needle around the eye, so people get nervous about needles in there. We don't use a needle. You do get a little intravenous, so we give you some medicine to make you feel relaxed, but we don't have to put you to sleep for this procedure. And almost everybody can have the procedure. There are very few patients who, for whatever medical reason, can't have the procedure, but it goes very quickly. People are blurry the day of surgery typically, and usually within a few days people are seeing very well. We don't restrict activities afterwards. People go right back about their normal lifestyle, and typically people come in with a cataract in each eye, so we do one eye, and then usually 2 or 3 weeks later, assuming they need the other eye done, we do the other eye.
Okay, all right. Now, you were the first person in Connecticut, and I hope I get this right, to implant a Symphony Toric multifocal LOL. Tell us what that is and what are the benefits?
It's a Symphony multifocal IOL, which stands for intraocular lens.
Okay.
And in the last several years, in addition to being able to give people good distance vision, we now have implants, Symphony being one of them, that give people intermediate and or near vision as well as distance vision without glasses. So back a couple years ago, I guess it is now, I was the first person to put in a toric Symphony multifocal implant. A toric lens is a lens that corrects astigmatism, which is a curvature abnormality in the cornea that about half the people in the United States have. To greater or lesser extents, where the cornea is curved more steeply in one direction than the other, and that creates an eyeglass prescription issue where most people who have a lot of astigmatism know what that is, and they have this correction put into their eyeglasses. Well, now we put that correction into the artificial implant that we put in the eye when we take the cataract out, so that even people with astigmatism, severe nearsightedness, severe farsightedness, all the various problems that we all have with our with needing eyeglasses can be pretty much completely corrected with the artificial implants, the Symphony Toric multifocal being one of them.
Interesting. I always think when I talk to a doctor like yourself, what did they do 100 years ago, 120 years ago, 130 years ago, when your eyesight went bad, when you had a cataract? You just had to live with it and hope for the best.
This is true. Or the surgery was done in a very crude fashion, and we didn't have implants, so people had these very thick Coke bottle glasses.
Right.
Most of that I don't see anymore because I've been putting in implants for 38 years, 37 years.
Sure.
But before my time, it was you would remove the person's cataract, and they would wear these very thick, very heavy, we call them Coke bottle post-operative glasses.
Sure.
Now we don't have that. Back at the turn of the century, of the turn of the 19th century, I'm not sure what they did. I wasn't around then.
They sure could have used you.
But yeah, things have dramatically improved. In fact, even when I finished my residency, before we had these, or as we were just starting to have multifocal implants, we waited very, very long for people to have really dense cataracts before removing the cataracts because the Coke bottle glasses didn't give normal functional vision. They gave sort of a pinhole central vision,
Right.
but people had dramatic distortions in the peripheral vision. So we knew that unless the person's cataracts were really advanced, they call them ripe. You've heard the term
Yeah,
ripe.
sure.
We don't use that term anymore, but patients still think about ripe cataracts.
Oh, yeah, sure.
Back then, unless the cataract was really advanced, patients wouldn't notice much improvement, even though their cataract was removed, because of the fact that we didn't have good optical correction for the patient following cataract surgery. Now we do, and all those issues have pretty much gone away.
Doc, we're running out of time. If people want to get in touch with you, what do they do? Is there a website, first off?
Our website is www.pinkeyecenter.com. It's PINKEEYE Center, CENTER.com. Our office phone number is 203-924-8800. We're in Shelton, Connecticut, right up north of Bridgeport, right off Route 8 at exit 13.
All right. Keep up the good work. And I know we'll talk to you again. Thank you so much for stopping by.
Thanks a lot. Take care.
All right. Dr. James Pinke here on WACC 600. Get ready. We're going to check traffic and weather. That's all coming up. So keep it here to WACC 600. Good morning.